If you enjoy this content, please take a moment to rate and review it. Your feedback will greatly impact our ability to reach more people. Thank you. Vic, what's going on in the world today?
I don't know. The last hour, there's been lots of breaking news. It seems like every day there's new news out of D.C. I'm worn out, but it keeps coming.
Is the latest thing RFK talking about cuts?
Yes.
That's the latest thing?
Yeah.
Okay.
Yes, we're recording on Thursday, but there's, I don't know, just like a barrage of, it's been that way since January 20th, just kind of like this constant stream of news. A lot of it, significant changes.
Did you do a bracket this year?
Yeah, I did a bracket.
That's
Let's talk about
amazing.
the bracket.
No, listen, that's amazing.
That's more
Dude,
fun.
Tell me about your bracket, because I didn't do one because I have no brain space for that. So tell me about your bracket.
I did a bracket with my two sons, and I'm doing well. I still have my final four in place.
Really?
Yeah. So we'll see.
Even with all the upsets so far, you still...
I mean, I didn't, Buffett gave away the $1 million. Someone got so I did not get every game in the first round correct, but someone did, and he's paid out $1 million, I think, yesterday. Oh, yeah, he was definitely going to pay.
He was definitely going to do that.
Yeah.
That's cool. That's cool.
Yeah, so we'll see. The games are going to start up again tonight.
Yeah, I'm looking
a lot of SEC teams in it.
Yeah, I mean, this is kind of the thing. I mean, I was so happy to see Notre Dame win the National Football Championship because of how stacked the SEC is just getting in every single sport. I mean, it's just, it's totally crazy. Yeah. The stuff that's happening at the college level. There's some stuff happening in soccer right now. NIL in the portal have very much completely turned college sports upside down.
Yes.
Like the number of things those two things created.
Yeah, I think for the worse, but people would argue both ways, but definitely changed it around.
I mean, it's probably for the better for the families of the athletes.
Yeah, maybe.
It's probably on net better for the families of the athletes. But if you're just a fan.
Yeah. Yeah, and I saw this one study that because of the NIL and portal, there's a lot fewer upsets in March Madness now. Just because the little schools don't have as much. Yeah. They don't have as much money, and you can't recruit a player out of high school that not many people know. Maybe he grows a little bit, and then all of a sudden you have a run. Now that player takes off and goes somewhere else.
It's just like the Mag 7, man.
Yeah.
It's just like the Mag 7. Yeah. We're approaching peak capitalism, man. I tell you, we are. The winner take all. Mindset is just kind of continuing to make its way through all aspects of America, and
and capitalism's in college sports, and just like whoever can raise the most money from alums ends up having the best team. Yep.
Well, I'm glad your bracket's doing well.
Yeah.
I'll have to check in with you when we get to the actual Final
we'll see.
Four and see
we'll
how you
I
did.
do. Yeah.
I'm impressed that you even had the bandwidth to do it. I couldn't.
I mean, I didn't spend a ton of time researching it. I just sort of do it. I mean, not the best mascot, but
here's the rest. Here's the real question. Did you get any help from AI?
No, I did not. I did not even.
I'm proud of you. You do use AI for everything.
I do, but I don't know. I think it would have been a lot of effort getting enough data in for AI to be good, but maybe not.
I think a lot of people used AI for their brackets. So I think the models were probably pretty ready for it.
Yeah, maybe. Well, I'm doing it the old-fashioned way.
Good. We gotta keep humans in the loop.
That's right.
For something. This is our last show before the Jumpstart Health Summit, which is next week. And the only reason why that's really of importance to our listeners who are not going to be there is because we will be recording an episode at that event and rolling that out a week later. So we're excited about that. Anything else before we get to the news?
No, I don't think so.
All right, with that, let's dig in. First, starting with home sales rising 4.2% in February, beating expectations. That's somewhat surprising.
Yeah. I was not expecting it to creep up like that. It's not a huge jump, but more than expected, and a positive sign.
Yeah, 4.2% increase in existing home sales, 4.26 million. I don't know. I mean, I think on one hand, people are settling into the idea that you're not going to be able to wait it out when it comes to rates.
Mm-hmm.
I think there may also be a sense that your job may not be as stable, and so if you want to buy a house, you might need to go ahead and just buy the house, while you still have the job. So I don't know. I think there's a lot of things that this data point could tell us. I'm not exactly sure what it tells us, but for the realtors, I'm sure they're happy with it.
Yes.
Next up, Trump announces 25% tariffs on imported cars and car parts. Saw this come up on LinkedIn. It was the first place where I saw this news. I guess maybe 2 weeks ago, I was on X and I saw Elon reposted that Teslas are like one of the only car makers that are 100% made in the United States, and was sort of showing the breakdown between parts, labor, and assembly, and all those kinds of things for all the other car makers. And it was not a complete exhaustive list, but it was Tesla against like 6 other very big names. And Tesla was the only one where sort of all 3 of those categories were presented as being made in the United States. So you have to wonder whether or not any aspect of this is, obviously it's a natural thing for Trump to focus on from a tariff perspective. Automakers, there's a lot of sort of different parts and components, and a lot of pride in where a car is made. But also Tesla's been hurting pretty bad over the course of the last month or so. So, you have to wonder whether or not there was any embedded support here for Elon from Trump in this move.
Yeah, I mean, I don't know about that. I think there probably is some influence there. But I think the main thrust is that they want to try to get America building things again, and cars is probably the most visible thing that's connected to, you said, the pride in U.S. manufacturing. And in Tennessee, we build a lot of cars, and it's not just in kind of the classic Midwestern states, although certainly there's a lot of car building there too. So I don't know. I mean, if it drives foreign manufacturers to put facilities in the U.S. and do more parts here, then it will be good. If it turns into a tariff war and we're all basically taxing each other, that'll be bad. That's sort of the case for all these tariffs, I think. So.
This might be a good point to bring up. I mean, things are happening. It's crazy how fast things are happening that now we do a show every week. And I feel like there's some stuff that happens in between the shows that it kind of gets covered in the larger news cycle, and it kind of dies out by the time we get to our show. Yeah. But maybe 3 things I want to bring up. The 2 All-In interviews with Scott Bessent and Lutnick, and the JD Vance speech at the American Dynamism conference from A16Z in DC.
Those are all at least posted Friday, Saturday.
Right. Yeah, exactly. So less Lutnick, maybe more Bessent to really sort of hear the articulation from our head of Treasury around tariffs, and sort of the thinking on that. I thought he came off very, very well in that interview, and I thought he's a great representative for Trump on these matters of it's fiscal policy, but it's also like trying to change the direction of the ship. Right. The way that Bessent tells it, he basically got involved because he was really worried about the Biden administration's spending, kind of a la Ray Dalio. It's very much from that song sheet. But he didn't really give a lot of credence to the negative that could come from these tariffs. Did you feel like he spent a lot of time doing that, or that the All-In guys pressed him at all on matters of like what are the downsides of tariffs?
No, it was a not a promotional speech, but he was giving his perspective of what the administration is attempting to do with economic policy.
Yeah.
And I agree that he's a very strong member of he might be the strongest member of the cabinet.
He's very strong.
And he's a market participant. Like he's been in hedge funds trading for his account and for his fund's account. And that's the kind of person that we want in charge of things.
Yeah. I mean, learned at the knee of Soros and Druckenmiller.
Right.
It's
pretty good.
It's pretty good.
And I'll say that there is this belief system that I think comes down from Trump that you wouldn't sign up to be in his cabinet unless you at least got comfortable that we're at least going to run this play. And whether I think it's 50-50 or 80-20, I don't know, but you shouldn't join Trump unless you're willing to sort of do that thing. And my interpretation of that is America is a very large economy, and we have a strong military, and we can demand that other countries are respectful and are fair with us, and we think some of these aspects have not been fair for years, and we want to correct that. Not everyone shares that confidence that these acts of tariffs, which are certainly, I think, aggressive, are going to lead to some negotiation where everything is happy 6 months from now and we're back to free trade, but at a place where the U.S. is on a much more fair playing field. If that pans out, that will be great. It's certainly not 100%.
Yeah.
But I think Besson is certainly smart enough to know that, I'm sure he has studied tariffs in history, and it can go badly too. Yes. But I don't think he would say that I don't think he would, if he was going to say that, I don't think he would have joined the cabinet. I think he's like trying to put this position forward, and he's doing it in a way that is, much more credible than how Trump talks in their sound bites, because he knows that's what most of his voters, I think, that's all they listen to.
Right.
It was great to have an hour or however long it was. It was deep,
about an hour.
A lot of detail, and they talked about many things, but they didn't touch on sort of what could go wrong scenarios.
Yeah.
I'm not sure he would have answered it, but they could have asked maybe.
Yeah, I don't know. I think he would have answered it. I think they just threw him a bunch of softballs and kind of asked him about his background and some of his historic trades and things like that. Maybe even more impactful was the Vance speech, because he kind of went on the offense against globalization. He basically tried to look. I actually thought Vance did a good thing, which was, as the guy who wrote Hillbilly Elegy, but also hangs out with VCs, he tried to kind of be the communicator between those two worlds, right? Between the middle to lower class populist and the tech bro. Or he called it tech optimist, but whatever.
And I think it's been a concern or something to worry about in the Republican Party.
Oh yeah.
And instead of ignoring it, he went directly. It was like one of the first lines he said.
He went directly at it,
which I thought was really good. Whether you agree with him or not, it's good that he addressed it.
Look, Vance has been impressing me in terms of his ability to do prepared speaking since the debate against Walz. In fact, I think that was a little bit of a turning point in the election.
Yeah.
In the campaign,
no question.
So anyway, his two big things were the two conceits. It's pretty strong,
right?
Pretty strong. Just even framing it as two conceits, right? The first one, which was, he said, the idea that you can separate design from manufacturing.
Yeah.
And this ties very much into the AI superpowers book, which is, we sort of passed all the manufacturing capability off to China. What do? They get better at manufacturing, and that actually improves design, and eventually they're good at copying, then they get good at innovating, and now we have BYD, right?
Right. They moved up in the stack as far as kind of value added manufacturing.
Yeah.
Starting off not very much value added, but then doing design and we really didn't.
No.
We didn't. We just gave away all the manufacturing stuff with the conceit, to use Vance's word, that we could always keep the design.
Yeah, and I think the fundamental truth that I totally agree with here. Look, I used to be a software engineer, right? And it's like I always believed that software engineering was a creative process. It was a design creative process, and you could take 10 different developers, give them the same sort of PRD. Here's what I need you to do, and how they actually produce the final product and what the final product looks like can be vastly different between those 10 different developers. So there is a creative interpretation,
at least in sort of the elegance or even functionality
Absolutely.
of how it's executed.
Absolutely. So that, I think, as someone who's got an engineering background, I could not find fault with that argument. The second one, I think, is maybe the one that ties into this that I want to talk a little bit more about, which is cheap labor as a crutch, right? This idea that cheap labor is something we should be seeking out, right? Which obviously, when you see cheap labor elsewhere, you do a couple things. You imply that the goal of capitalism is to continue to decrease to decrease labor costs. And B, you also ship jobs elsewhere where people are willing to work for a lower cost than people in this country, right? So and those things do hollow out the middle class. I don't think so. He made two compelling points. I think how you get back from where we've been, not 5, not 10, but decades of globalism, like how you get back from there. I don't see how you do that without tremendous pain. I think about it basically the same as like you haven't worked out for 10 or 20 years and then you start working out. Like it's going to be the first year is going to be hell. First year is going to be hell, right? And it's just a question like after the pandemic, after all these things we've been through, like can America go through hell? Can we go through this hell right now? I just think it's a question.
Yeah, I part of the reason it's frustrating that there is no Democratic leadership debating Vance, whether it's directly or in
party.
other party,
Democratic Party, okay.
Yeah, well, that would give another perspective. Is I don't think we can continue on the path that we're on right now, where we outsource to other developing countries, really use their labor at very low rates, and they also don't take care of the environment and do practices that we wouldn't allow here, both worker safety and environmental practices. And then we benefit from having cheap goods on the internet or in stores.
Yep.
But that Vance talked about this, that loss of purpose. Like, okay, I can get a T-shirt for $2, but what am I doing with my life? Like that loss of like, I have a job that I'm proud of that I do, and it gives me some sense of meaning. I think there's something that's important there.
Yeah.
I don't think it has to be with this medicine. I mean, both Besson and JD Vance are talking about it as like a detox or medicine to like get us back on the right track. I think the status quo doesn't work. And so the reason we need the progressive side of our country, which is about half the population,
well, yeah, sure,
roughly half, to contribute, is that that's how we'd get to the best answer.
Yeah, of course.
But I think it was for that audience and this time, I think he did a good job sort of addressing the elephant in the room, that the Republican Party has these two camps that on the outside don't look like they would get along very well, and how he would connect them where they all are aligned around this plan.
Yep. Yeah. So I don't know. I mean, I wanted to bring those things into this 25% tariff bit because I think maybe the next story here with Axios, we're talking about the April 2nd tariff day, which is the reciprocal deadline for other countries to make changes, or if they don't, then we will enact a reciprocal tariff. That's next Wednesday. Is that right? Next Wednesday?
I think we are coming out with like a series of tariffs to try to make it equal in reciprocal between countries. How we talked about it last week. How we do that is going to be complex, and then maybe it will all decline as we negotiate. But that's a big maybe.
Well, I mean, there's that, and there's also like there hasn't been a single tariff that's been announced that hasn't had some counter, measure implemented by the adversarial country in that context. I mean, I think it's a naturally adversarial move to employ a tariff. So I think calling them an adversary in that context is correct. You just start rolling them out across the whole world. I mean, just everyone get ready for April and May to just be chaos.
Yes, it's going to be. And I agree with the thesis.
Yeah, and maybe stay off X and Truth Social if you're on either one of those, because my God, it's just going to be.
Yeah, I agree with the thesis. It should be no tariffs on either side, or if there's some purpose of having a 5% tariff or 10% tariff, okay, but it should be reciprocal. But it's not there now, so making that change is going to be
very
huge change.
Very hard. Johnson & Johnson is going to invest over $55 billion in the U.S. over the next 4 years. This is what Trump is looking to see more of.
Right.
U.S.-based companies that are investing more significantly than they have in the past domestically. For Johnson & Johnson, this investment represents a 25% increase from the previous 4-year period. So that's meaningful.
Yeah, and it's positive. We need more of this to offset the negative sides, but I think every story like this is really helpful because it's just signals some hope that J&J believes they can build factories and find people and staff jobs here in the U.S. Which is great.
Look, if you care about America, you can't be mad at that.
Yeah,
this part you can't be mad at. Maybe the model of diplomacy and how we're implementing these tariffs. Yes, I mean I think there's a lot to talk about in terms of the how, right? But driving more domestic investment, obviously, if you care about American, citizens and the American economy, this is a good thing. Okay, so Trump takes a tough approach to choking off China's access to U.S. tech. This is another Wall Street Journal story. Starting to see rumblings that Silicon Valley is feeling like this is not what they signed up for when they decided to totally back Trump. Maybe they thought it was going to be much more of a shindig for the private markets. And no, I mean, I think the succession of these stories really demonstrates that Trump is very savvy in terms of what he does during an election cycle and what he does to make bedfellows. And he does make good on many of those promises, but sometimes people will extrapolate those into other things that he never actually agreed to.
Right.
And they discount the principles that he said he was going to bring into office when he was elected. And I think that has been a fatal mistake for many who backed him, thinking he was going to take their personal agenda. Mm-hmm. I principally think about Silicon Valley and the crypto community.
Yeah.
These are kind of the two key communities that I think about here that thought he was going to be all about their agenda.
Right.
And lo and behold, he's about the principles that he said he was going to be about.
Yeah, and he's also changed from Trump administration 1. That's, I think, where a lot of people that I was talking to before the inauguration, that I'm talking to now, that's been the big change. Like, oh gosh, yeah, we knew he's blustery, but in Trump 1, as long as the stock market was doing well, he was sort of also there, and that he had worked to almost like not quite a put call, but he was trying to make businesses successful in the stock market, which was helpful to people that have a lot of financial assets. This time around, he's not doing that, and that's a pretty big change.
Yeah. So before we go any further, like what's the detail here on the the China access to U.S. tech?
Well, so I mean, we were talking about China's acceleration and capacities in AI and how it could be really damaging for the U.S. if they beat us dramatically. It's very similar to atomic weapons or something. If you have an outsized lead in AI, that could be really damaging. So we want to try to reduce China's pace in that. So the NVIDIA chips, and we're trying to reduce their ability to get U.S. technology to compete with us.
Yeah, so we're limiting their trade access.
Yes. We're not allowing them to buy NVIDIA or Blackwell chips.
Yeah. And of course, conversely, that will boost Huawei chips.
It boosts Huawei chips, and it leads to DeepSeek, where they're like forced to reinvent a whole new architecture.
Right.
That's the human innovative spirit. So Biden started this. And so Trump didn't start this.
No.
Biden,
Trump set DeepSeek up.
Biden set DeepSeek
I'm sorry.
up.
Biden.
Yeah,
Biden set DeepSeek up.
Yes. And Trump is doubling down and extending into many more products and closing even kind of like pretty small loopholes, because he's doing it using AI and with technology, and he has brought in people from Silicon Valley that can go find even fairly small loopholes and close them, which I don't know if it's good or bad, but it's going to be a tighter export controls on any technology, which might mean that we handicap their ability to grow. It also might force them to innovate and invent new things.
I think at this point, there's no way it actually handicaps them. I just that just doesn't feel real to me. Like, I think they're already plenty advanced.
Yes.
And I don't believe we have that much of a technological edge on them that they can't fix through some crafty thinking, like they did with DeepSeek, using less powerful Huawei chips, but maybe just a lot more of them.
Yes.
So, to me, it just, I don't.
I agree. I don't think it's going to work.
Yeah. I don't.
I'm not against
China
it, really,
in particular. I just don't think this is an effective strategy against China. Delaware punches back at Texas efforts to lure away companies. So we've been talking for months now about how Elon specifically has been driving corporations away from Delaware and to Texas and Nevada, but principally to Texas. And we've seen and talked about the Texas Stock Exchange, which is really New York Stock Exchange, setting up an office in Texas. NASDAQ, last week we reported on them, moving an office to Texas, to Dallas, I think it was, for Y'all Street. And so the governor of Delaware realizes this is their cash cow and has basically put a new law in place to basically address what that judge in the case with Tesla and the shareholders got wrong, per at least our analysis, right? Which is basically limiting the ability of minority shareholders to sue the majority shareholders of a company, specifically the deciding shareholders, which are usually founders, right? Even if you've got like multiple different classes of stock, and there may be many more sort of in the B class. The A class holds the decision-making authority, and they're starting to implement laws that will limit the ability for the shareholders to sue the company. So it's interesting, right? It's like they're not holding the line. What they're instead doing is they're saying, we're going to be more like Texas.
Right. Yeah.
That's what they're doing here.
Yeah. I mean, that's probably okay, but it seems like, Elon won. Or the corporate power should be held by controlling shareholders. One, we should have a legal person maybe talk through it, but there might have been a reason why this law was there, and it could have been interpreted differently in this particular case. It feels to me like they're letting one high-profile case change the whole structure, but that's what they're doing. And I think it will stop some of the people fleeing out.
Well, I don't think it's just a high-profile case. I mean, I think this tells us what the news stories haven't been able to tell us, which is that, in fact, companies have been going away from Delaware and moving to Texas, right? That they are losing business.
Yeah,
I
think that's clear from the fact that they made this change.
Yep. Moving into VC, Navina lands $55 million from Goldman Sachs. This is a Series C round of funding. It's a clinical intelligence company. This round was led by, in addition to Goldman Sachs, Vertex Ventures Israel, Grove Ventures, Alive Israel Health Tech Funds, obviously an Israel-based company, or at least founded in Israel. Total funding now for Navina is $100 million. This round's gonna accelerate the development of AI tools to help providers with visit preparation, pre-charting, diagnosis, capturing, and automating documentation.
Yeah, and so it's going full steam at sort of being a co-pilot for the doctor in the clinical setting, helping with differential diagnosis, helping prepare for the visit, helping charting and follow up. It's like it's a doctor co-pilot.
Yep.
Which I think is good that we are seeing this, and there's a lot of things to consider with that.
Yeah, I mean, it's crazy because we've been talking about this for it feels like almost a year now, where the majority of the VC stories have been AI.
Oh yeah,
feels like about a year.
At first, they weren't in the clinic. They weren't like in clinic.
Yeah, now that's over.
That's over now.
Now that's over. But truly, it's like we're really just getting started, aren't we?
Yeah.
Like we're really just getting started.
Yes. The oldest clinical AI companies are probably 9 months old.
Yeah.
And so they're not even a year old yet.
No. So. We're just getting started. I was listening to No Priors, which is like kind of the big AI podcast, and Abridge was on there.
Oh, really? Yeah.
And I bet it's probably the first time they've covered like healthcare AI on that pod.
Yeah.
So I think we're just at the beginning, Vic. Just at the beginning. Silna Health, this is Axios, gets $27 million for insurance automation. So, yet another revenue cycle management automation company. I mean, I don't know, not that exciting, but it just shows you how ripe the revenue cycle management space is for AI, not just in terms of like the need, but also the appetite. Huge appetite on both the payer and the provider side to just automate this whole thing.
Yeah, revenue cycle's been the easiest place to look to gain efficiencies and get some better cash flow for 15 years.
Yes.
And I like Axios's comment. It's at least the seventh major health revenue cycle investment round that they've covered since last summer. So there's all these new rounds, new companies getting started, which is good. There's a lot of options, but I was talking to a guy yesterday in the revenue cycle. He said, hey, it's just overwhelming. It's hard to even evaluate what to look at.
Yeah, I don't... knowing all the stuff that's going on in the space, I would not be all that excited about investing in one of these companies. And again, this is why I think we're just getting started, because I think people have tackled... When we first started talking about a lot of AI, it was all like rad tech, Now we've been basically talking about scribes and revenue cycle management nonstop, and it's interesting that Navina was a little bit more across the board in terms of all the things they're working on from an AI perspective. But we're just getting started. I think. Startup insurer Arlo raises $4 million on back of AI powered underwriting.
Yeah, so this is pretty interesting. This is there's just different ways you can point AI, right? So instead of using it to figure out how to treat a patient or do revenue cycle, they're using it to kind of crawl through all the claims for an employer and then underwrite the risk more effectively, and then either help the employer rebid it, or maybe take it self-insured, or just be smarter about how they do it. They have a partner that will take the kind of co-insurance as well. So it's an interesting use case.
Yeah. Series of stories here from Wall Street Journal Pro. First one, health tech VCs look to AI for next wave of returns. I mean,
this is like a hope story. I mean, we're all hoping to have big exits, and I think probably health tech VCs are like every other VC.
Yeah, maybe a little worse.
Maybe.
All right. Two of a kind founder of snack company seeks to back next big consumer health startup. Daniel Lubetsky invests in health and longevity companies through Camino Partners. So I like this guy. I've seen him in a couple of different podcasts, and he's a big thinker. Like, he's got a pretty non-traditional background. He created the Kind Bar, which
right.
I think when he did it, nobody thought it was going to be anything.
Yeah.
And it's a multi-billion-dollar company that
sold for $5 billion.
Yeah. Sold to Mars. And he's out here looking for things to do to make the world a better place. That's kind of his entire focus. And so it's good to have him added into the group of people who are going to be investing in longevity technology. I think that's good.
Yeah. And longevity is a really interesting market, because you have people that believe they can do A, B, C, and D and live to 150.
Yep.
And so that can feed a lot of excitement and a lot of revenue and growth in the space that could be really good.
Yep, absolutely. All right, this is an important one. Andreessen Horowitz aims to raise a smaller bio fund. The firm seeks to raise $750 million for its next life science and healthcare fund, half the amount collected for the strategy in 2022. So, this is the kind of thing that you want to be careful about reading too much into, because there could be all manner of reasons why they're doing this, and we're not inside of their office,
right,
deciding what the right strategy is for how you size a fund. Okay. We know that they are massive believers in AI, and it could be their belief that AI is going to dramatically lower the cost of drug discovery and development, and that it just should not take as much capital to start the next one. So,
yeah, it could also be that they're not putting any AI investments in this fund, or I don't know how they structured it.
Yes.
Like you're saying, that we don't have the inside scoop on it. But half as big as last time is a significant change.
It's a data point to watch and see if any of their other funds, they manage many funds.
Yeah.
If any of their other funds end up being smaller than the last vintage.
Yeah.
If so, that would indicate that even the mighty Andreessen Horowitz is not exempt from the lack of liquidity in the private VC markets.
Right. Yeah. I think probably both are true, but I don't think anyone's exempt from the lack of liquidity.
Doesn't feel like it. Doesn't feel like it to me. All right, moving to Fierce Healthcare. Duke-Margolis launches a council to build health-focused frameworks for private equity. So this is kind of the academic world trying to step in, and from a think tank perspective, it feels like here, try to help private equity clean up its act in terms of the way that it approaches healthcare.
Yeah, that's right. I don't have a lot of confidence that it is going to be listened to by the entire private equity market.
Right.
I'm sure there'll be some private equity firms that are fine with this, but it's a pretty large and diverse set of people in private equity. Cerberus, who did, they lead with, because of the implosion at Steward Health, it's a poor example. We need to set a better framework.
Yeah, and also a recognition that private investment is really important in healthcare. And I think even more now that the government's pulling back so much, you're going to need these private dollars. Otherwise, there's going to be a lot of implosions happening in the healthcare ecosystem. So, look, I certainly applaud the initiative and the why behind it.
Yeah, I agree.
And then you're probably correct in just acknowledging capital animals are, capital animals. So,
yeah, I mean, it either is legal to invest in anything in healthcare, or it's only legal in this framework.
Right.
And I don't think they're going to have that kind of strength.
Influence.
So you're just going to be asking, some of the most financially oriented incentive folks to please follow these guidelines because we're asking you to.
Yeah, I mean, it feels like ESG to me.
Yes. Yeah.
RFK Jr. prepares 10,000 more job cuts across HHS, outlines office consolidations. When you pair that with the early retirement and fork in the road offering from early this year, HHS will decrease its headcount by 20,000 members.
Yeah. This is the story that just came out a couple hours ago. It is, they're cutting from 82,000, I think, to 62. So it's a significant number of people, and it's also a significant percentage. We have it, and we'll put it in the show notes. Robert Kennedy did a 6-minute thing he published on X just to get his story directly to the people. He says a lot of nice things. It's hard to know what's true and what's not true, right? So he's saying there's duplication of departments. I can't quote it exactly, but maybe there are 18 different HR departments, 15 different IT departments, and we don't need all of this duplication.
Yeah.
Which sounds right, but we also, I think, need to recognize we're losing a quarter of our staff at HHS.
Yeah.
Which is going to be a lot of people.
In his talk, he says under the Biden administration, HHS increased its budget by around 38% and staffing by about 17%. So, he's laying out his case. It's worth listening to for sure. And also, that's a lot of job cuts.
Yeah.
That's a lot of job cuts. All right, here's a story from the Wall Street Journal. And, I think we're going to get more of these. It's not like we didn't have them before, but now there's a lot of, I think, appetite for these kinds of stories where you're talking about fraud, waste, and abuse, or it's probably waste is probably the correct thing to frame this particular article on.
Well, and I think government workers starting close to the top are also kind of like trying to get these stories out. Yeah, probably. The headline here is taxpayers spent billions covering the same Medicaid patients twice. So this story kind of lays out that in the height of Medicaid enrollment rolling off of the pandemic, basically you had somebody, they were enrolled in Medicaid. If they moved from one state to the other state, basically both states were paying for the same person, even though the person is only living in one of the two states, right? So that's one example. And then they kind of extrapolate that and show you how close to $5 billion was wasted, in this kind of scenario. Kind of two states covering the same person. They do a breakdown of the different payers and how that waste laid out. To be fair, the payers are referenced in the article. They do talk about how much money was paid back and how this article is not complete in its assessment. Generally speaking, when I read big brand publications talking about healthcare, I tend to agree with that because they're not trade pubs. They're not going to get into the wonky stuff, and also they get into, they're into rage. You know what I mean? So if they can make people upset, that's part of their goal here. But I think we're going to get more of this, right? I mean, there was a while there where there was a steady drumbeat of stories about the PBMs. We're not seeing as many of those anymore, but there was a steady drumbeat. Then there was a steady drumbeat about private equity. Yeah. I think this whole Medicaid waste thing, it feels like we're moving into a new drumbeat of stories rolling out around this. Yeah, I think that's probably right. And I understand why in the middle of the pandemic, it made sense to not worry about who was eligible for Medicaid and who wasn't. Or like, if you claim to need Medicaid, there was a period of time when we, as a country, said we're just going to let everyone that needs care for our poorest, our poverty prevention health system, we're going to give everyone care. Yep. And I think that was the right thing to do. And I think sometime between then and now, it should have been fixed. And so if someone, in the example in the story, someone moved from Florida to Georgia, I'm sure that happens all the time. And it seems to me Florida should be checking their Medicaid rolls every year. And if that person's not there anymore, they shouldn't pay for it. I mean, I don't. But as you know, states don't have good systems between them, and Medicaid patients are very, very hard to track. I'm not making excuses. I'm just saying we got to make sure we talk about the reality of the situation as it exists today. You may not know that the person left. Yeah. Or there may be some delay in you actually finding out. And while that's happening, you're still rolling out payments, and then you kind of have to, go ahead and clean that up.
later on.
Yeah.
So
it's a hard population to keep track of.
It is a very hard population to keep track of.
And we don't want people to lose coverage because they moved a block away.
No.
And so
what would you err on? Would you
right?
You know what I mean? Like it's just kind of making sure that we're being intellectually honest around the challenge here and around what would be the logical way to operate this. And again, like I'm not for wasting taxpayer dollars. That's not the point. It's just, to me, this feels like one of many, hit piece is too strong, but one of many stories around this particular storyline that somebody wants to make sure get out. You know, that there is waste, maybe even fraud, but there's certainly waste in the Medicaid system that needs to be addressed, so that when the Medicaid cuts come, it tracks with the narrative that's been, rolling out there.
Yeah, I think that's right. I also think we have other systems that cross state lines, so it's possible to.
I don't know why my driver's license isn't on my phone, Vic. I mean, there's a million systems that should be, because some states have driver's licenses on their phone, right? So there's a million systems that could be upgraded. I agree.
Yeah. So I agree that we need to be careful about it,
and at the same time, we're trying to go back to like paper ballots and like some people, you know what I mean?
Right,
so it's like, what are we talking about here, right? On one hand, we need AI. On the other hand, we want to go to paper ballots, Okay, Axios, how Medicaid and SNAP cuts could affect your state. So this is this is a bit of an analysis here, kind of projecting what might happen, but trying to sort of make sure people understand how many jobs are tied to Medicaid and SNAP benefits that roll into the states. You may just think about the recipients, but there's an economy underneath that as well.
Right. Yeah, and the effects are not evenly spread. So for people that aren't watching, there's a map of the U.S. and New Mexico and Louisiana, Kentucky, Oregon, and New York are going to have the most projected job losses, which was surprising to me. I didn't realize. I just hadn't really thought about it, but I guess it is concentrated in different areas.
Well, I mean, I think the surprising thing is that the concentration is spread out. It's not regional. It's like it's and
I can't even. It's not easy to see what they have in common.
Yeah, what's the pattern here? They're all over the country, literally.
Yeah.
So there's something about those specific states and decades of policymaking that they've been doing to build infrastructure around those federal revenue streams, right?
Yeah, how they dispense the money or how it's set up or something.
Yeah, exactly. But it doesn't seem to be blue or red. Doesn't seem to be regional or anything like that. It's just kind of some states versus other states. Yeah. Right. So something to track for sure. Back to fierce healthcare. CDC Doge claw back $11 billion in COVID-19 grants nationwide as the agency roots out censorship contracts. So, I mean, this narrative around everything that was happening on big tech in particular, I would say Google probably got the most emphasis, particularly YouTube, where you'd have a video and it would review your video and then run some type of thing underneath it, a little banner underneath it that would say this video is talking about COVID-19 and the vaccines. The vaccines are safe or whatever. Click here to go to the CDC. It's all of that, right? It's that and everything related to that. Right. That obviously, certainly RFK and many who were behind Trump really hated this. And so this is not surprising at all. Not surprising one bit.
No. And I guess CDC was providing grants to Google and other people to fund that process, that they would be flagging things and sending.
Now, I have to ask, did you know that?
No.
Yeah, I didn't.
And I'm not even sure that Google is getting money. I just used your example. But
Right.
But there's $11 billion of grants overall that are, I guess, supporting or funding this, in quotes, censorship. Censorship, we were talking before the show.
That's a political.
It's a politically charged word. I mean, one person's education is another person's censorship.
Yeah, that's right. I mean, that's the whole misinformation, disinformation conversation. That we're not litigating that at all. We're just saying it's clearly political football at this point.
Yeah.
But another billion,
another 11 billion,
another 11 billion,
billion here, a billion there. Yeah. It's going to be real money.
That's right. Senate confirms nominees to lead the FDA and the NIH under RFK Jr. So this is Jay Bhattacharya and Marty Makary.
Yeah. They both got through. Not really surprising.
No.
And I think they both seem like pretty good picks.
Now, look, these two in particular, I would say were solid prior to any involvement with RFK or this administration. Yeah. I genuinely felt very bad for Dr. Bhattacharya and what he experienced. And it is kind of related to the whole censorship thing, honestly, right? What he experienced. Marty Makary, I think, has for a long time now. I mean, did you get to see him in your fellows class? He came to our fellows class.
No, I don't think he came to mine. I don't know.
I mean, he's sharp, man.
Yeah.
He's sharp. And he's been a critic of the healthcare system and all the ways in which it should be serving American citizens for a long time before this. So I don't know that he had aspirations to sort of lead the FDA. I was actually kind of surprised. He felt a little bit more like a CMS guy to me, but he's not quite as high profile as Dr. Oz is. Right. But he's a sharp guy. He's a sharp guy. And it's interesting that his confirmation actually pulled more Democrats in. It was not a pure party line vote. So both these guys are pretty sharp.
Yeah,
pretty sharp guys. Yeah, but I mean, you could say that Bhattacharya has got a bit of a grudge. Given what he experienced.
Yes, I think it would be hard not to.
Yeah. All right, so I'll let you take this one. This is a story from the New York Times talking about it's really bioethics around embryos.
Yeah, it's bioethics. It's a woman that writes about bioethics who also went through in vitro successfully. And she's discussing sort of the prevention of scientific investigation beyond 14 days of life. And that there's a lot to consider. And there's a lot we could learn that would really be beneficial in medicine in those early weeks and months. But of course there's a lot of ethical considerations because the older the embryo gets, the more concern there is.
Yeah.
And so there's a long story in the New York Times about that, but she has a pretty interesting perspective because she's kind of seen it from both sides. That's why I found it interesting. There's just a lot to consider. And I think the world is changing quickly. We have talked a ton about AI, but biotech and sort of all the things coming off biotech like this with CRISPR and genetic engineering is right on the heels. It's probably 3 years behind AI, but that's like, in another year or two.
No, and truly the only thing holding that up is the bioethics and I think really the religious sort of implications of it, right? Because we're talking about AI and LLMs and humanoids. We could just as easily be talking about cloning.
Yeah, and I think there will be. I think there's going to be some countries that have different scientific rules than the U.S. And so it's just going to be something to keep an eye on. And this was a well-written from a good point of view.
Very much. And talking about cloning, Wall Street Journal, Chinese scientist ostracized over gene-edited baby seeks comeback.
Yeah, so this is the guy that actually created the human clones. I guess I don't know what you would call them. Maybe that's not the right thing to call them. But he got in trouble.
Cloned humans.
Cloned humans, and he got in trouble for it. He is trying to make a comeback. He has new ideas about how to use genetic engineering to improve human reproduction. He's not allowed to leave China. From the Chinese government won't let him leave. and he doesn't have the same kind of lab he had before, but he's working to get resources and come back, whatever that means.
Yeah.
And so to me, these are like two stories that are bookending the concepts.
Yeah. He posted on X on March 11th that ethics is holding back scientific innovation and progress. He's been dubbed by international media as China's Frankenstein. So, I mean, and I think that the precarious place we have to just admit we will find ourselves is just as we are all walking around with supercomputers now. Mm. There's certainly going to be a day where it will be much more generally available that you can pull together the things you need to pull off something like gene editing without a lot of money or an academic affiliation or
attracting attention.
Or exactly, or any of those kinds of things, right? And in those situations, somebody, there's billions of us here, somebody will do it. Somebody will do it, right? I mean, we're moving to a world where superior artificial intelligence, maybe not AGI, but certainly superior artificial intelligence is going to be accessible by us all. By us all.
Yes.
And so, your ability to sort of take inspiration from a guy like I'll try to pronounce his name just for the benefit of the listener here. He Jiankui. I
think it's pretty good.
Yeah. And look, I don't know. I mean,
what he's promising is attractive, period. Like, he's trying to prevent Alzheimer's disease in your children and your grandchildren and everyone in the future of your family line. And that's something that I would want. The problem is that it's not clear that he can deliver that or what the side effects would be. Like, okay, no one has Alzheimer's, but they have some other issues.
Yeah.
But people are going to be attracted to the optimistic side because humans are attracted to the optimistic side.
It just rhymes with gain of function to me.
Yeah,
you know what I mean? And it's just like, should we be opening that box? You know what I mean? Like, we're playing with some stuff
we should not open the box. I want to be on record. We should not open it. But we are. But someone will. Someone will. Your point is right.
Yeah, that's my point. Because in a world of infinite possibilities with billions of people, and as you make capabilities more broadly accessible to those people, someone will do it.
Yes,
that's just that will happen.
And it might be really bad with, children that are not really very healthy. But it also could be another version of bad, which is we have wealthy people that can give their kids higher IQs, better athletic ability, whatever they want to program in, but it's only open to some subset of the population, which also has a lot of negative repercussions. So I think it's bad all around, but at the same time, it's likely to happen.
Yeah. All right. Optum, CVS, and Express Scripts GLP-1 programs entice employers. So they are putting a little wellness protocol in front of the GLP-1s to try to manage costs for the employers, and saying that, they want to see employees not just take the GLP-1s, but also get engaged and go into the gym.
Yeah. I mean, I think on the balance, it's good. I mean, it is a good practice to have exercise and eating, lifestyle, nutrition plans when you're also on a GLP-1. So putting that in front of it and making sure that they're committed before they get the drug, I think makes sense. But the other thing is it reduces the utilization.
Reduces utilization, yes.
So it's kind of both end.
Yeah. Hospitals establishing hubs for digital health operations. This is just kind of a cool story, especially the pictures here in this modern healthcare story. It just shows control centers, basically.
Yeah.
various nurses. At least that's what it appears to be here as a nursing team.
Mhm.
And they're all sort of looking at these huge screens, and they're all in a row here. And it looks like they're driving a command center, probably, controlling and tracking an entire floor of patients.
Yeah.
From here.
Yeah. At Vive last year, I guess 24, the CIO or someone at Guthrie presented sort of their monitoring. So they're using cameras to watch patients and sort of monitor them for falls and things like that.
That's great.
And they're great. They're having great success. And sort of,
why wouldn't you?
Yeah. I mean, so pulling together medical professionals with technology in a central location, but then treating your entire catchment area, every health system should be doing that. I don't know why it's not common.
No, it's very cool. All right. Sad story of the week. 23andMe finally files for bankruptcy. CEO Ann Wojcicki resigns, and it's all sorts of stress and chaos for the customers of 23andMe as they're trying to get their data off the platform. And yeah, not great.
Yeah. I mean, this is a sad ending to a sad story. I mean, it was exciting for a while, but they never really built a business that could work. And the motivation to figure out where are my ancestors from, that doesn't last that long.
It's
like
not enough.
You learn
It's not
that.
enough.
Well, you learn that, and then okay, I know. And then you don't need to
not
pay
enough.
the monthly subscription for that anymore.
Yeah.
So there wasn't really. It just didn't play out to a real business.
Yeah, I mean, to me, it just feels like it just got way out in front of where we actually are with genomics.
Yeah.
And I actually think like the interface and the branding and the customer experience was actually quite good. I just think they were way out in front of where the market was for it. Like, the healthcare industry is not engaging them. The research industry is not engaging them. They didn't have those things locked in. So, this is one of those like build it and they'll come. Let me aggregate all of these genomes, and that will be sufficient for me to sort of encourage these industries to engage with me. And it simply didn't do it.
Yeah, I think that's right.
I think the bigger thing that this is going to do is it's going to question all genomics-based businesses, all biobanks that are not sort of embedded inside of a health system or something like that. Just anything like that, you're going to look and you're going to say, why would we walk down the same path as 23andMe? Because honestly, it doesn't really feel like it was a completely mismanaged business. It was just more there wasn't a business there.
Right.
Just wasn't really a business there.
Yeah, I think that's right. And you trust this company, but then when they go to business and go bankrupt, it's going to be bought by someone else, and that's why all the customers are trying to get their data out now, because who knows who's going to purchase it.
Yeah, so things can go bad in the business world, and this is one of those unfortunate stories. And I personally, I hate to see it. I really liked 23andMe as a concept. I thought their execution in terms of customer experience, branding, what they did, what they were able to generally maintain in terms of security. They didn't have massive high profile hacks or things like that.
Right.
I think they did a lot of things right. Just there wasn't a real market there.
Right.
There wasn't a real market there. So unfortunate for sure. This is a pretty cool story. You want to take the lead on this one?
Yeah, sure. So a figure skater, her name is Amber Glenn. She had a career, which happens to a lot of athletes, that she would perform very well in sort of the preliminaries or lead up events, but she never really won the big events. She kind of choked, or she couldn't win the big world championship events. And so she went and talked to her trainers and sort of rethought how she would approach it. She started doing biofeedback training to really kind of put her body into the experience where she's all kind of keyed up and, fast heart rate, exercising really well, and then be able to calm herself down. Like you would practice anything, you can practice getting control over your internal process, your heart rate, your mental state, your brain waves.
Right.
And she has not lost in, I think 10 months. She's just like killing it.
Yeah.
So I think it's interesting. I really like the intersection between like sports medicine and psychology in general. So I was interested to see her doing this. I think biofeedback training and meditation is something that there's a lot of promise for. I haven't spent enough time on it, but I want to learn more about it.
Yeah, I'm big on this stuff for sure. Big on neurofeedback, big on biofeedback. I'm just now getting back into meditation. I did my third meditation session this morning for the week. And I mean, I go on these like stints where I'm like good for like a year, and then and then I'm shit for a year. So I've been in like a not good for a year kind of period. So I'm trying to kind of get back on the boat.
I like yoga or more like moving meditations. I find that more easy to stick to. But yeah, it's not the same. It's not the same benefit.
It's not the same. Right. Like the thing that I noticed just on day 3 is, I think you just get a better sense of like the soundtrack of thoughts running around in your head, and you know, I've been doing it long enough that it doesn't take me that long to catch it. I don't judge myself, and I can observe it and be like, oh snap, man, these thoughts are like on repeat. Yeah. You know, so it's just something to know. It's just helpful to know that you've got certain soundtracks that are going on and you think they're not you.
Yeah, that's the benefit I've found when I've been able to do it, is like getting even just like a little bit of distance between that soundtrack or my thoughts and then what is really me or what I have to take action on. They're not the same thing.
They're not the same thing. Right. Yeah. So this stuff is awesome. Obviously as an athlete and you know someone who kind of learned how to compete as a child. So I don't as much understand how I do it. Yeah. But I know other people who actually compete quite a bit but struggle rising to the moment. When, you know, in the training room or in practice, they're unbelievable, but then they go out on the mats and they can't quite deliver the same performance there. It's a pretty consistent thing amongst athletes. And it would be great if we could figure out a way to unlock that. Yeah. Because it would translate into performance in more than just this area. I think it would translate into relationships and you know, the workplace, et cetera. Right. Here's another sort of Health in Us story. What happens to your brain when you retire? I think this is going to be a bigger story than most people think it's going to be, because AI is going to force some early retirements, unfortunately, or at least people needing to reboot their career and rethink what they're going to be doing. So it's probably worth thinking about what happens when either you retire or your job is retired for you. But what's kind of the key takeaway here?
I think the key takeaway is that a lot of us, I'm not sure I'm in this camp, but a lot of people are looking forward to retirement. I can take a break. I can not be stressed. I won't have to work so much. I won't have all this pressure. But they don't really prepare for what they're going to do. They're just so excited to go relax that they don't plan for it. And then they don't have anything to really keep themselves busy intellectually. And so you atrophy your brain over a pretty short amount of time, 6 to 12 months is what the article says. You start to atrophy. Mm-hmm. And I think I've been thinking about this a lot. I hadn't connected it until you just did the intro, but I kind of think that in order to keep up with the new technology, it really is about just like trying to fight through the interface or the confusion. It's hard. I don't know how to use whatever tool I'm trying. And there's a point in people's life where they just feel like, well, I'm old enough that I'm not going to. I'm not going to go through that anymore. I don't need to learn that. My kids will do it, or I don't need to do it anymore. And so you stop fighting through that learning curve, and then it's just over. And I mean, I see it with older people and like apps or cell phones, or I think it's going to happen with AI quickly. And it's really, it is that like an aspect of curiosity, an aspect of like, this is the work of keeping up to date.
Yeah.
Just like of working a little bit every week on the learning curve of whether it's AI or some new medical technology or whatever you're interested in. I don't think it has to be one particular thing, but just keeping cognitively your interest level up is important in retirement.
Yeah, for sure. All right, our AI rundown. Trampoline AI launches out of Redesign Health to empower health plan call centers.
Yeah, so this is one of the most likely early places where AI just runs the table.
Call centers.
AI, call centers in general, because people don't like to wait on hold, and it's hard to be in the call center in that job. And so they're coming out of redesign, and I think it's going to be good.
And also the conversational LLMs are getting ridiculously good.
Yeah.
Right.
Yes.
Ridiculously good. That's to me is the thing is and we're about to do the AI rundown. So we're going to talk about some incredible things that happened this week. But it's crazy how just in the last week, I feel like the media that I've seen produced, and I'm not just talking about people showing me stuff from the latest OpenAI thing.
Yeah.
I'm stumbling upon things like on X or Instagram or whatever. And I'm like, whoa, like, it's AI that made it, but you're like, but did AI make it? And then when you accept that AI made it, you realize how good it is. Like, it's so good. Yeah. And you're just like, oh man, we're cooked. We're cooked. Like, because this stuff is still in beta, Vic. It's all still in beta. We're not even in like ready to go general availability with this stuff. And it's just getting so good so fast. What a ridiculous time to be alive right now. It's just.
Yeah. I was trying to learn about the MCP protocol that we'll talk about in a minute.
Yeah.
So I just did a search for podcasts, and the first 4 were AI generated podcasts. But I listened to one and it was useful.
Oh yeah.
I mean, it was what I wanted was to quickly get up to speed on this model context protocol.
And you were able to.
And it was great.
Yeah.
And they had just like us, they had 2 people, a man and a woman, going back and forth. And I wasn't even sure it was AI. The only reason I realized, I thought this doesn't seem real, but I couldn't really know. But then the next one on the list was the same 2 voices, but with a different spin. That one was done for a sponsor. Yeah. So they were positioning it for a particular sponsor.
Yeah. And by the way, if anyone's played with Notebook LM, this stuff advances so fast that like I have no idea what the quality of it is now. But basically, you can generate a podcast based on notes that you put into Notebook LM, and it'll have 2 people talking about it. Like literally just right in the interface. You upload the docs, or you tie in the YouTube feeds or whatever. Yeah. And then there's a little thing just like generate audio. You click that, and the 2 people will have a conversation. A guy, a man and a woman will have a conversation about all the stuff you put in there.
Yeah. It's pretty good.
Just AI-powered databases boost the Alzheimer drug discovery process. This is another Alzheimer story related to, how technology is likely going to be cracking the code on Alzheimer's. I mean, it's starting to feel inevitable, quite frankly. Like just the mountain of technologies and the advancements of it. It's like we're gonna figure this out, aren't we? Like, I just feel like we're on that timeline where we're going to figure this out. We're actually going to solve this one.
I think there's enough attention and enough sort of compute power on it now that we'll figure out something.
Yeah. By the way, this is Oxford. The Oxford Drug Discovery Institute is leveraging AI and knowledge graphs to go through biometrical data to work on finding a cure for Alzheimer's. Yeah. All right, now I think we're getting into our industry stories here. So OpenAI rolls out image generation powered by GPT-4o to ChatGPT. The images are, this is the first one. I've been down on the image generation stuff for a while because it all has this look to it. This is definitely the first one where I'm like, oh man, like the deep fakes are going to be everywhere now. Yeah, everywhere. That's it. We've crossed the Rubicon this week. This very week. Yes. Is the week.
It used to be that if you were not just like quickly glancing at something, almost anyone could spot an AI image generated. The fingers weren't typically that good. Background people or even like trees and things weren't just, it didn't have all the landscape correct.
That's right.
And then you really couldn't manage text. Ever.
The text was terrible.
Can't have any text.
Yeah, the text was always bad.
So and I didn't think about it, but there's a lot of text, just like a restaurant sign, or there's text in all kinds of stuff.
That's right.
When you try to actually use this, didn't work, and that got fixed this week. So this one, if you're watching online, the four most popular cocktails, and they have a picture of the Aperol Spritz, Margarita, Espresso Martini, and Mojito, and how to make it. And it's really good.
It's perfect.
Yeah.
It's not just really good. It's like
better than you and I could do, like, if we took half a day and like set it all up in a studio.
It's perfect.
Yes.
So, yeah. I mean, photographers, graphic designers, graphic design tools, the wave of disruption that's coming from this one release.
Yes, there's something about
crazy
fixing the text and the colors and the image characteristics together when it moves around the scene, that OpenAI and Google both figured out in the same week, or they released it in the same week.
That image that you need for your presentation, we need to see if we can generate it.
Let's talk about that later.
Yeah,
I don't know. I got to catch up with what you mean.
FundOS.
Oh, yeah. Yes. Okay. We can definitely do that.
Right?
Yes.
Right? I like literally just hit me like, why aren't we just like doing that?
Yeah, we can do that.
Why don't we just do that?
Yeah.
Okay, great. OpenAI adopts rival Anthropic standard for connecting AI models to data. So this is the MCP, or model context protocol, that you were talking about earlier. It's a little bit wonky, but every once in a while we want to take you guys into the depths of what's going on here with this AI stuff, so you can understand like some of the protocols that are being built under the hood to connect all these systems together. This is an important one because it's open source. Anthropic released it, but OpenAI adopting it kind of means that this is going to be the protocol now.
Yeah. So
this is how different AI systems will be able to talk to software systems. You can kind of think about it like an API that is AI readable.
Yeah, I mean, the context, not a lot of people that haven't played with AI that much think about context, but there's sort of the intelligence layer. Then there's what can it do? Like, can it look at a website? Can it send an email? Those are more like capabilities. But then the context is really important because it allows the AI to respond in a way that makes sense for the environment. So a lot of times I'll be putting in 20, 30 pages of context into the prompt, because then I get a much better answer out.
Yeah, but you have to feed it manually.
But you have to feed it in there. And so this is a way to store context, either for your own models, to be able just to pull, like you might have like 15 different 4-page documents about different aspects of the healthcare industry that I'm investing in.
Right.
And I don't need them all every time, but when I'm investing in this one niche, I want to pull them in. I would have a library and just be able to tick off the boxes. But then what's really interesting is you can then share it. So like if another venture firm wanted to collaborate with me, we can, on this context protocol, we can share with each other, or we could even sell it to each other or market it. And so I think it's going to be a whole nother layer. It's like, you're right, it's like an API or SDK kind of layer.
Yeah. Really good news that OpenAI adopted this, because I think there was some question as to whether or not the Anthropic, backing was sufficient to make this open protocol work. There were a lot of other cloud providers, Replit, et cetera, that had signed on to it, but OpenAI really pushes it over the line. Yeah. So that's great. Anthropic, Databricks team up for in a scramble for AI revenue. So this is just, I think this is good for Anthropic. Databricks is already massive, B2B platform in the cloud storage integration space, and they've decided to partner with Anthropic. So that's awesome. Likely because of the coding capabilities of Claude, 3.7 Sonnet, and whatever else is on their roadmap. But it's going to be great to for all the Databricks clients to be able to have, Claude integrated into their software. So
yeah, definitely.
All right, and another Anthropic win. This is one in the courts. So Anthropic scores a win in the AI copyright dispute with record labels. Universal Music Group sought an injunction against Anthropic training against copyrighted lyrics. They basically were saying that there was going to be reputational or market-related harm. And basically the courts denied the injunction, stating that the record labels had not demonstrated how using the material to train had actually caused that harm yet. So this is an injunction. This is not like a full-on suit. This is just trying to get them to stop. I doubt this is the last of it. This is just one court. These kinds of things tend to make themselves present in a series of different, jurisdictions, et cetera. But it's certainly a win for Anthropic here, just because, any time you can get AI sort of greenlit by the courts to train on copyrighted data, that's a pretty big deal.
Yeah, I think it is. It's going to be really difficult if you have to show where the damage was done in order to stop the AI models, because after the damage is done, the damage is done. But that's right. They didn't get the injunction because they didn't demonstrate where Anthropic has impaired any of their artists or harmed them. At the same time, I think I can make a Taylor Swift or Ariana Grande song sound pretty good. So
it's inevitable. It's just inevitable.
Yes, I think that's right. It's just gonna come.
It's just inevitable. All right, Thomas Friedman. You may recognize that name from The World is Flat. Mm-hmm. This is the guy who sort of talked about globalism. So time for him to pop back up, I think. Not to say he's gone anywhere per se, but it's probably time for him to start opining again. Yeah. And this is really interesting. This opinion piece in the New York Times, he's basically talking about how AI, and most importantly AGI, is about to show humanity that all of its demarcations and nation states and all these different things are actually irrelevant. And you are one human race, and you're going to have to find a way to align to try to contain AGI.
Yes. And we should not worry about what China is doing. That's immaterial. We have a bigger threat, which is AGI becoming the smarter, faster, better species, sort of the next step in evolution after humans. That's his point, that we should align with other countries, almost the opposite of what the Trump administration is doing because of this looming threat. And I think it makes a lot of sense. I also don't think there's any chance it's going to happen.
I'm glad he's on record saying it. Good for him. Yeah. Very smart. Very smart to go on record saying it. If you turn on cable news, what percentage of the day do you think they talk about AI?
Maybe 1%, 2%. Not even. Not very much.
Max 5, right?
Yeah,
max.
Yeah, very.
Max.
If there's some big story that gets attention, they might talk about it.
That's right. It is really something else to be this close to AGI. We're about to talk about Gemini 2.5 in a second here, right? It is something else to be this close to it. And generally speaking, oblivious.
If we walk outside and ask 100 people, maybe 2 will have any opinion at all, and they'll say it's a long time away. And it's not.
No.
I think it's here now, but we'll talk about it in a minute. But Tom Friedman is correct, and ain't nobody going to listen to it.
Nope, sure not. So, all right. Google is rolling out Gemini's real-time AI video features. So Gemini can see screens and camera feeds in real time for some Google One AI premium subscribers now. I am one of those. You are too.
I am too. Yeah.
So I got to try this weekend. I don't think I can handle it tonight. We're actually getting pretty late into the night here recording.
They turned this on about a month ago, and I tested it, but it wasn't really, it was buggy and didn't work, and then they turned it off.
Okay.
So it'll be cool to have your AI co-pilot just kind of
see what you see.
Yeah, just hanging out with you in the office. I mean, not actually sitting with you, but watching everything.
See what you see though through the smartphone camera. Yeah, that sounds awesome.
Or through your through your screen. I don't need him to see me. I need him to see the screen.
Sounds great.
Yeah,
everything's gonna be fine. Google Gemini 2.5 Pro came out this week, and on basically every benchmark beat every top model. And this is a big deal because Gemini has not beat anything in a while. It's been considered a laggard, kind of a dog, and 2.5 Pro and handily beat in many things. The link we're going to share to Matthew Berman, who's a pretty prominent YouTube AI guy, demonstrates this Rubik's Cube test that it's a one-shot test. He's assembled all these one-shot tests that he puts all the models through to kind of see how close they are to AGI.
Right.
And Gemini 2.5 Pro is the only thing to not only come close, but actually blow away the Rubik's Cube test.
Yeah.
Whereas the other models struggle with it, and
they can't even sort of
get the color. They can't even execute the test, much less run through all of it. So yeah, I mean, we're putting the link in here. It's a long video. You probably can get the gist of it in about 5 minutes of the video.
Yeah, if you watch the first, even 3 to 5 minutes.
Yeah, 3 to 5 minutes, and you'll kind of understand what Google has pulled off here. And it's just, I don't even know what to say at this point.
Yeah, I mean, I tested it it came out yesterday.
Yeah.
I tested it last night driving in the car. Just like picked up my phone and talked to it.
They said it was an AI studio, but it's rolled out. If you're a Google One AI Premium customer, it's already rolled out there.
You can't the image generation that he's doing is in AI Studio, but the deep thinking and then all of the complexity behind it is just in the regular interface.
Okay.
Yeah, so I was on my phone driving in traffic and just figured I'd try it out. And I intentionally asked a pretty vague, complex question just to see. Usually it gives me nothing.
It stutters
back.
On that. Yeah. Can't really figure it out.
And it was like talking to a 30-year-old person that works with me. It happens to be a female voice. She would ask me some follow-up questions and then did a search on Google that she can do, but the search was this very complex set of terms with a bunch of Boolean things in that I couldn't even follow, but it got an answer. It wasn't the answer I wanted, so then I asked her to look in the 10K of a publicly traded company, which she then did, and within 10 minutes I got the answer while I was driving in traffic. It's crazy.
Okay, so the final story. We made it to the end. Hour and a half for the show. New York Times, are you smarter than AI? And it's some puzzles that you can play to see how you actually fare against the AI. If you're feeling froggy, click the link in the show notes and play with it. I have to tell you, I probably will not, because
I don't want to know.
Not only do I not want to know, I already know.
Yeah, right.
I already know.
I'm not smarter than Gemini 2.5.
No.
There's no way.
No.
I also don't have the access to the entire internet in my head. And I never will. Hopefully I have some value to the world, but it's not that.
Oh my God.
So one of the things about AGI is we don't have a definition for it, but we're close.
But Vic, it's
here. I think it's here.
It's like pornography. You know it when you see it.
Yeah.
Right. And I think that's what AGI is going to be. It's like you'll know it when it starts doing things like a human autonomously.
Yeah.
Not on command, on its own. That's when we'll know it. I don't care about someone saying, I've run it through this benchmark of tests and this is AGI.
Yeah. Who cares about that?
I don't care about that. When it starts acting like a sovereign individual with all of that power then we're there. And then we got a whole nother set of things we got to
if you
deal with.
If you put Gemini 2.5 with Luna, Luna?
Yeah.
If you give her that brain, she's there.
I know.
Now, she doesn't have that brain,
No.
but she probably has it by now.
Are we sure?
She probably has it by now.
Are we sure?
She didn't have it yesterday, but maybe she has it now.
I mean, like when you look at the rate of all this stuff, and you also think about the logistics of what it actually takes to roll something out, right?
Yeah.
Don't you realize, like, oh, this is why all the fallout's been happening at OpenAI and why the people like saw something and they got spooked and they quit. It's like, we're already there.
Yeah. Yes.
We're
That's
already
right.
there. You know, for all intents and purposes, we're already there.
Yes.
Right.
That's right.
So now it's just a matter of like, how under control is this thing?
Yes. And how fast does it change healthcare, society?
Right.
Our jobs as podcasters.
Right.
I don't know.
That is the big question, isn't it?
Yes. And so I'm not going to take Are You Smarter Than AI? I'm just going to work really hard to be a very smart human that can use AI, because I think it's not a test I want to take.
No, same. All right, great show. Thanks for putting it together.
Yeah.
And we will both be here next week after the Jumpstart Health Summit.
Yeah, excited for it.
See you then.